Hello and welcome back to Hudson Health. My name is Dr. Kimberly. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. I'm very excited today to welcome a very special guest to talk all about heart health. Dr. Kimberly Skelding is Chief of Cardiology at Jersey City Medical Center and really a world-renowned expert in cardiovascular care, especially new technologies around treating patients with all kinds of heart problems. Heart disease is the leading cause of death in the United States for both men and women and doesn't seem to be abating. Now, heart disease kills more people than trauma, car accidents, and here at Jersey City Medical Center and RWJ Barnabas Health, we're very interested in making sure Hudson County stays healthy. We're going to have a very interesting conversation with Dr. Skelding. I'm excited to talk to her. We have a full show ahead. We want to make sure that as a community, we continue not just to treat heart disease, but to prevent heart disease and keep this community healthy. Again, it's going to be an action-packed show. Can't wait. Please invite your friends, loved ones. Stay with us. Stay for the whole show. Thank you.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, Light Rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. Kimberly. I'm Chief Medical Officer at Jersey City Medical Center, a division of RWJ Barnabas Health. Today we're going to be working with Dr. Kimberly Skelding, who's our Division Chief of Cardiovascular Services, and really discussing all about heart health. As I mentioned earlier, heart disease remains the leading killer of men and women in the United States and really becoming a national epidemic. We're very excited at RWJ Barnabas Health that we have innovative new approaches to treating existing cardiovascular diseases, and not just treating disease, but really detecting diseases at an early age. Anything from imaging to actual intervention, a lot of them not as invasive as they were even when I trained as an emergency physician many years ago. Today we're going to talk about not just these new interventions, but the difference between some of the more traditional methods, as some of you know. One of the things that we're really going to emphasize today is the challenges of managing heart health in the community, and really a lot of preventative work. Listen, the best treatment is prevention, as a lot of you know, and we would like to know how screening, prevention, and more upstream work leads to that. We would like to know the role of the challenges that women especially face, which is something that's an interest of Dr. Skelding. How are women different than men, and how can we treat heart disease in women more than men? Then something I've talked to her at length is testimonials from patients. I think it's more endearing when you hear your neighbor or your friend give a testimonial to a doctor. And we've had some of these newer techniques that are only available at RWJ Barnabas Health, used by patients in our community. We would also want to know where cardiology is going to be in the next 5-10 years. As medicine continues incredible advances, we know that the future is only going to be brighter. And we're excited because people do not have to travel across the river to get these interventions. They can stay right here in this community. Something near and dear to my heart is education. What is the role of education, and how do we put the patient in the power seat or in the driver's seat, as it were, for their health? How do we educate patients so they can make healthier lifestyle choices to prevent cardiovascular disease? We're going to talk about all this and more. And finally, how do we continue, once patients are well, to continue their checkups and making sure they're seeing cardiologists in the area? So stay tuned. We're going to have a very, very exciting show. We're going to have a lot more to discuss with Dr. Kim Skelding.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one path stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. E.J. Akunyili. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I have the extraordinary pleasure of welcoming Dr. Kimberly Skelding, a world-renowned expert in cardiovascular care and Chief of Division of Cardiovascular Medicine at Jersey City Medical Center. Welcome, Dr. Skelding.
Thank you. It's great to be back.
Yeah, it's good to have you back. So excited because there's always things to talk about.
Of course.
Heart disease remains the biggest killer in the United States. We do want to make a dent in that statistics. So I'm just going to ask you, what are the new technologies? You always tell me about all the new technologies we have at Jersey City.
Sure. So a lot of things are going on in Jersey City. It's really an exciting time to be there. We are definitely innovating in valve disease. We are at the place where we are treating almost every valve disease percutaneously. So without an open heart surgery, which is really great. We are doing research. So traditionally, we have participated in research trials, but now we're doing them in cardiovascular disease. It's really exciting. So we're being able to bring the latest technologies to patients in our population. One other thing we're doing is we're increasing the subspecialty clinics. So we're going to have clinics for hypertension and women's heart disease and valve disease so that we can have dedicated time to focus on specific problems that we know are a big deal in Hudson County. The other thing that we've brought, which is really exciting, is some new and advanced technologies for women in heart disease, which is really great.
That's exciting. We can't be happier to have you as our chief. Now, I know what valve disease is, but many viewers at home, can you tell us more about valvular disease and valve disease and how you treat those and some of those new innovations specifically?
Right. So most people will know they have a murmur, but not realize that a murmur is a sound that we hear while using a stethoscope on their chest, listening to their valves. And so anyone who has a heart murmur should see a cardiologist. Very important. Valves can get diseased over time and maybe not open all the way or not close all the way. And many years ago, maybe 15, 20 years ago, the only options we had were open heart surgery. And now we can go through small blood vessels in the leg or sometimes in the arm to go into the heart, replace the heart valve, and get the patient home often at 24 hours.
So that's a big difference, right? Mm-hmm. Big heart surgery versus going home in 24 hours through just going through blood vessels or this percutaneous approaches you talk about. So, I mean, it seems obvious, like one is a big surgery and one is less so. But tell me, from the testimonials you've heard from patients, what's the difference in their lives to be able to have a non or minimally invasive approach?
Well, it's life-changing, right? It doesn't mean there's not risk. I mean, we're still doing a major procedure. We're just using a minimalist approach. But just within the last 6 months, I've had 2 patients, one an elderly Latino man who came into the clinic, was really thinking that he was on his last legs. And he said when he came back for his follow-up, I feel 17 again. I mean, it was crazy. I was like, we all brought everyone in from the clinic who had been there when we were working him up and explained that to him. Another woman we have who's been wheelchair bound, really limited and in and out of the hospital with heart failure, is now starting to walk again after almost 2 years with heart failure. So it's really exciting. To be able to be part of this is really life-changing for the physicians, myself included, who do these procedures. Now, it isn't without risk. So there are, patients that we have to really have these very serious conversations with. But when it causes an improvement, which is most of the time, fortunately, it's life-changing. Life-changing.
That's absolutely fantastic. I think nothing is as heartwarming in the healthcare industry is to be able to change, not just get people to live longer, but to live longer, happier lives. And maybe your patient who is 17 again can now go off and do things he never could do with his children, grandchildren.
Right.
But, all these good stories, but we also know that Hudson County has pockets of an underserved population. That's something we've talked about on the show. That's something we're very passionate about at RWJ Barnabas Health in Jersey City because we believe in equitable health to everyone. What specific challenges do you find in Hudson County?
Right. So we know in valve disease across the country, we undertreat. In Hudson County, those numbers are even lower. We know in peripheral vascular disease, we have a high rate of amputations, not because of procedures not going well, but of patients coming late to care. And so those things are so vitally important to get people to get care for their heart problems, their blood vessel problems early. And so what we are doing is going out and meeting with community leaders and trying to meet people where they are. Mm-hmm. Identify what the needs are. Is it an educational need? Is this a screening need? Even to the simple things of thinking about treating the risk factors. We know someone has a problem. How do we get them directed toward healthy food, healthy medications, to the right things so that their problem will not get worse, or if it is going to get worse, takes a longer time to get worse. But early treatment and prevention are really the key.
So that's great. I will talk more about education in the next segment, but I did want to ask you, So you talked about early detection and access, and you're a world-renowned leader in cardiovascular health as it relates to women. Is there a difference in when women present in terms of early or late with the same problems?
So yes, I mean, a lot of people, and I'll talk about valve disease because that's sort of near and dear to my heart. But people think that as they get older, that it's normal to get short of breath. It's normal to not be able to do things. It's normal to have chest pain and not be able to do the things they did. It's not necessarily a normal progression of age. And so when people start to see their, what we call functional capacity, their ability to do things, as simple as walking around the grocery store and now needing to push a cart, or now needing to park closer, or not being able to carry your bags to your apartment. All of those things are changes, and they need to be really evaluated because it's not always a normal stage of aging. And so women are much more, I mean, we're caretakers, right? So women are caretakers. They're taking care of their family, taking care of their spouses. And with that, they start to put their care on the back burner. And so they say, I'll get to it. And so they don't get to care as quickly. And they often present later, and also present later because they just sort of diminish their symptoms. Well, I'm just getting older. It's just,
I just need to lose more weight.
I just need to lose weight. And so we really encourage them really to get to us early.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to Hudson Health. I'm here with Dr. Kimberly Skelding, Chief of Division of Cardiovascular Services at Jersey City Medical Center, a facility of RWJ Barnabas Health. I'm Dr. E.J. Acconelli. I'm Chief Medical Officer at Jersey City Medical Center. So Dr. Skelding, we left off talking about women in cardiovascular care and presenting late to care. It's just really fascinating. So I do want to ask you, there's a lot of research. So can you talk more about this research, and is the research just on women's valvular care, or what kind of research is happening in Jersey City?
Right. So we're starting in the cath lab, the cardiac cath lab. That's an area obviously near and dear to my heart. And because that's where I've done the predominance of my research in the past. And what we're going to be studying initially is treatments of heart attacks, And so looking at treatments, medication treatments, options for therapies, and follow-up. And one of the studies that we're doing is looking specifically at diversity. So a lot of times in the clinical trials, it has been studied in a very homogeneous population. And we really want to get data on people of color. We want to get different ethnicities. We want to get women into our trials because it's very important that we treat the patients based on the data for them. And so that's the kind of research we're starting on initially. We're also going to be extending this into our specialty clinics. So we'll have hypertension research and hyperlipidemia or high cholesterol research. All of these things will be encompassed in the research. It'll be a very comprehensive program. And we're just getting started. So I imagine if we come back next year, we'll have 100 trials.
Well, can't wait to have you back. So we've talked a lot about high-tech, new technologies, and the work you're doing in exceptional research. Really excited. But tell me more about just good old-fashioned early detection. How are we detecting disease early to avoid progression?
You're right. So I think it's very important, like I said, if someone has a heart murmur or someone has got legs that are sore, they are having a change in their capacity to do things, that they come in and be seen, and that they ask to see a cardiologist if they're concerned, because those things can lead to an early detection of a valve problem, of a blood vessel problem. And what we can do is we can monitor them over time. We don't need to see them every 4 to 6 weeks. We can see them once a year or twice a year while their disease is progressing. And then once they get to the point where we need to do something about it, well, then we see them more frequently. But prevention is really the best treatment for any disease. And so preventing it from beginning in the very early times of disease is really where we need to get to. Some of the simple things about lifestyle modification, it's never too early. So talk to people about exercise, 30 minutes a day, most days of the week. Fruits and vegetables, less meats and cheeses. Looking at the plate, have it be half vegetables, a quarter starches, a quarter proteins. Thinking about portion sizes are really important. And so we talk about these things early on in the hopes that we can prevent, or if not prevent, slow down heart disease.
Well, I think part of, we talked about technology, so there's sort of the high tech you have in the hospitals, but there's also a generation of people that have low tech, wearable devices. Everybody has a watch and may be able to count their steps. People actually even know their heart rhythm sometimes. So you think there's a role in some of those more widely used devices as people monitor their health, in addition to sort of keeping count of what they're eating and sleep and rest and all those things we talked about?
Sure. Some of them patients can engage in on their own, but some of them can be supplied from the hospital. But monitoring blood pressure at home when people are eating, sleeping, exercising, being able to wear a monitor that gives us all those numbers is so valuable. Because maybe every time the patient comes to your office is in the morning and their blood pressure is perfect, but late at night their blood pressure is crazy high. Well, it's important to treat that. And so having that data when they're at home, living their normal life, having their normal diet, so important. Same with heart rhythm, same with monitoring for atrial fibrillation. All those things are really important. And, it's good to do it in the hospital, but people are going to go home, they're going to eat their own meals, they're going to be on their own schedule, they're going to, do things at their own pace. And so we really need to know that piece of information as well.
No, I agree with you. And something that's always been fascinating to me is just the sheer amount of work your department and colleagues do in raising awareness in the community. You talked a little bit about going out to the community and meeting people where they are. Can you give more of an example of what you've done so far? Just examples to the audience.
So, in our group, we have people going out to talk to some of the local businesses, doing lunch and learns with them. I met with a number of community leaders at a local diner in Ward F. Learning the wards, Ward F, and sat down at the diner and talked about what do you need? What does this community need? And trying to identify how we can meet those needs with them where they are, in their community centers, at their churches, where they need to get the education, because not everybody can transport themselves. Not everybody's able to make time for it. Working people, maybe can't make things during the day, so we got to do things at night. And so we're really trying to have a comprehensive program to be able to engage with the community. And also very important, because I don't think a lot of people realize all we do. They don't realize all the amenities that we have there and how much we have grown over the last number of years. And being able to just go out and share that they don't need to go somewhere else, that they can come and stay at Jersey City and get the same care, the same caliber of care is so important. And that's a conversation.
I agree, as they can in anywhere else in the world, across the river, especially with the busy lives people have. Let's take one less thing away from you.
Right.
You can stay local and get your care, both preventative and curative care.
Correct.
Right. So if you had a crystal ball, 5, 10 years, where do you see cardiologists moving at such a fast pace? It's changed so much from when I trained. I can't even keep track anymore.
You know, cardiology moves at an epic pace. It is probably one of the most evidence-based fields in medicine. It really is, it's hard to keep up, which is why we need people to be subspecialized. You know, gone are the days of jack of all trades. We can't do that anymore. But what do I think's happening? I think things are going to get less and less invasive. I think that there is going to be more and more medications that are going to take the place of procedures. I think we're going to use more x-rays and specialty x-rays instead of invasive procedures. All of these things are happening at a super rapid pace, which is good for patients because we can diagnose them and treat them with less risk. And that's really where we need to get to. So I think things are, it's hard to keep up some days on the couple of areas that I treat, let alone all of cardiology. And so the two things are people getting more specialized and therapies getting safer for patients.
So that is why I told you all you were going to be in for a treat to have Dr. Kim Skelding with us. Looking forward to the next 5, 10 years of keeping this community healthy. Thank you so much for coming today to Hudson Health.
My pleasure. Happy to be here.
We'll be right back.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. E.J. Acconelli, Chief Medical Officer at RWJ Barnabas Health, Jersey City Medical Center. It was an absolute pleasure. I'd like to thank Dr. Kimberly Skelding, Division Chief of Cardiovascular Care at Jersey City Medical Center, for an inspiring segment. We wish you all health and wealth in this year. Let's be healthy together.